Hi, this is Dr. Paul with Car Injury Care TV. It's the internet show where we answer the most basic questions regarding automobile accident injuries, medical and legal. And today our spotlight guest is Dr. Greg Hollstrom. He is a chiropractic board certified neurologist in Largo, Florida. And the question we're talking about today is how not to have a permanent injury after an automobile accident. So first question is how often do you see patients that have permanent injuries after an automobile accident?
That would be very, very common. A lot of patients who have had injuries 10, 15, 20 or more years ago have been left with some permanent impairment, and oftentimes they are coming back and leading to a susceptibility to re-injury and frequent re-injury, and oftentimes we're seeing them for that.
Well, let's go back into the healing process and describe why is it these people have permanent injuries in the healing process? In short.
In short, permanent impairment in a nutshell occurs when the healing's all said and done. Is the tissue that's left over strong enough to hold itself together in what the patients are going to ask it to do?
Can you explain how, when somebody heals, how you can help them go through, let's say after an injury, and somebody goes through the healing processes? What are the different healing processes, and what can you do specifically to help decrease their likelihood of having a permanent injury?
Well, the first phase of healing involves inflammation. And inflammation occurs as the tissues are injured, and technically when tissues are injured to the point like we'd see in an auto accident frequently or severe sprains, there's actual death and dying of the tissue. And this releases chemicals which bring swelling to the area, produces a whole host of chemical reactions, but the net effect is it brings swelling to the area and stimulates pain nerve fibers. So it's very important that patients come to care early in this phase, because by reducing the inflammation and the collateral damage which occurs when circulation is disrupted to the tissues around the injury, we can reduce, number one, the scope of the injury, but we can reduce the need for the scar tissue to actually come into the area.
And so what would be specifically some things you would do treatment-wise to help them in that phase to not have a permanent injury down the road?
Well, in that phase here in the office, we will frequently employ strategies such as electrical nerve and muscle stimulation, which can help reduce the passive congestion in the fluid in the area, helpful in reducing pain. It can be helpful in reducing eventual adhesions, which occur later in care. We employ frequently ultrasound or ultrasound mixed with nerve and muscle stimulation. This ultrasound is a high-speed sound wave which comes out of a smooth metal surface, which is held on a kind of a handle, and it's use a coupling gel on the skin, and these sound waves, as they penetrate through, help to push the swelling out of the area, and also will be helpful in the additional phases that will be coming in the healing process. Other things that we will employ may be some manual traction, which will usually be performed on an intermittent basis, where the traction will be brought on and then released, which helps as a gentle pumping effect to help reduce congestion. We will perform manipulation. Manipulation meaning work with attention to joint motion and restoration of joint motion. As this inflammation process occurs, the pain nerve fibers which are stimulated produce a tremendous amount of reflex muscle spasm and stiffness. And that spasm and stiffness will hold these joints together, and if they're held together for a very short period of time, 24 to 48 hours, these adhesions, the scar tissue, will begin to form in the joint. So we'll begin to add light forms of manipulation of the spine or the shoulder, elbows. It depends on the individual
Right,
problem.
right.
Another strategy that we'll employ is axial decompression manipulation, and this was developed.
That's a big word.
Yeah, yeah. That was developed by a man by the name of Jim Cox. He's just a brilliant guy, and that is a form of long axis, meaning if this would be the long axis of her body, and would be just a type of distraction or it can be we use this in particular for the spine, both the neck, the middle, and the lower back, predominantly the neck and the lower back. And this decompression helps to improve nutrition in the disc with disc injuries, and it helps to open up joint spaces and nerve tunnels.
It sounds like if it heals that way, then that could possibly lead to a long-term or permanent problem.
Absolutely.
So it sounds like everything you're doing is trying to work these tissues physically to make them stronger, to make them more elastic, to where they don't have adhesions. Is that a fair statement?
Yeah, that's very fair, and that's what we're going to be, really concentrating on in these later phases is involving where this actual scar tissue is coming in a much greater fashion.
And what would you do in some of the later phases of healing to prevent permanent injuries?
Well, the next phase of healing is the repair phase. And in this phase, we're still dealing with some degrees of this inflammation. We're dealing also where the scar tissue, these fibroblasts are beginning to start to lay down the early framework, kind of like a skim coat over this injured area. And pain's beginning to reduce. The patients are beginning to feel a little bit better. And we will continue usually to employ forms of nerve and muscle stimulation, ultrasound. We'll change some of the protocols that we'll use with axial decompression to favor, well, depending on the injury, but sometimes there will be an increase in amplitude or a different range of motion that we weren't able to use initially. Patients will be employing some home care to help make sure that this phase is beginning to progress and move toward the following phase. Usually patients are not ready for active exercise at this point, especially forms of active exercise that will overcome the ability of the injured tissues to stabilize them.
And so that's the next step after that is active exercise?
Well, the next phase of healing involves the remodeling phase, and we try to get our patients involved with active exercise and strengthening as soon as possible. But a mistake that's commonly made in a lot of treatment of these types of injuries is movement into exercise too soon. The key is you want to do it as soon as possible, but only to the point where these tissues are functional and strong enough where they can begin to tolerate it. So it's usually at the point where the patients, are well into, everyone's different depending on what they bring to the table when they're injured as far as other problems they may have had prior to that. But generally as they begin this remodeling phase is usually also called the active exercise phase.
And how can chiropractic spinal manipulation specifically help reduce the chances of a permanent injury relative to these tissues you're talking about?
Well, in this remodeling phase, we have this scar tissue, and it's coming in, and it's being laid down in the end of the repair phase and moving into this remodeling phase. But as it begins to set, what happens is, as a normal process of healing, the scar tissue will begin to contract. Just as you've had a cut or a bad laceration, you can see the scar forming, and you can see that as it sets in, and then it begins to shrink. Well, the same thing happens in the joint, and this shrinkage of the scar tissue can lead to joint immobility, and joint immobility can be related to early breakdown in the joint and progressive problems with ongoing chronic pain.
I see. So that's why if you don't get the physical medicines like you're explaining, that's a lot of times why people have re-injuries and chronic problems. Is that a fair assumption?
That's a very common cause.
Okay. All right, good. All right, well, again, this is Dr. Paul with Car Injury Care TV, and again, we're talking with Dr. Greg Hollstrom here in Largo, Florida, a board-certified chiropractic neurologist.